If you're suffering from leg swelling with leg pain, skin discoloration, or wounds, you could be suffering from vein problems. You should seek medical attention as soon as possible to rule out acute vein problems like a blood clot or chronic vein problems like leaky vein valves. Blood clots themselves are associated with high mortality, and leaky vein valve problems can lead to necrosis of your skin, leg ulcers, which themselves negatively impacts the work capacity of an individual, amounting to a paramount 2 million workday loss per year in the US. Welcome everyone, this is Dr. Valentine here at Houston Metropolitan Medical. I will be talking to you today about chronic venous insufficiency or leaky vein valves, and briefly going over deep venous thrombosis, DVT, or as most commonly called, blood clots, as it can lead to leaky valves as well. So let's talk about one of the major differences between the veins and the arteries. As you can see here in this diagram, on the right side we have a red vessel that is an artery, and we have a blue vessel on the left side that's a vein. Arteries take blood from the heart down to your body, or throughout your body, and the veins bring blood from your body back to your heart. Since you have a heart and it's pumping throughout your arteries, there's no need for valves in the arteries. On the contrary, there's not a continuously pump moving blood from your body back to your heart, so the veins need the valves. Due to gravity, if we didn't have these valves, then the blood would pool down to our lower extremities. Also, we have superficial veins and deep veins. Superficial veins are readily right below your skin in the subcutaneous fat that we see here. Deep veins are beneath your fascia or usually inside the muscles. So what is chronic venous insufficiency? Venous insufficiency or leaky valves is a condition where the veins in your legs are unable to effectively return the blood to the heart. It happens when those leg veins valves don't close properly, allowing for blood to pool back to your legs. A blood clot is a condition where blood clot forms in the deep veins, typically on your lower legs, preventing blood to go back to your heart. So how do we evaluate this? So evaluation begins with a history and physical examination where we identify risk factors for acute vein problems or chronic vein problems like blood clots or chronic venous insufficiency. This could include recent surgery, hospital stay, pregnancy, oral contraceptives, hormone replacement, varicose veins, spider veins, all of that. Visible and palpable signs of venous problems can often be identified on physical exam, but not always, since we cannot assess the deep veins. For example, chronic venous insufficiency, or when you have leaky valves, may present with swollen legs that get worse over the course of the day. And signs of these are spider veins, corona phlebitica, varicosities, tortuosity. And although chronic venous insufficiency originates with abnormalities in the vessels, like the leaky valves, the target organ is the skin, which may also be indurated or thick or pigmented. And when this gets really extensive, it can lead to necrosis of the skin and lead to venous stasis ulcers. These venous stasis ulcers are usually located in the inner side of your leg, right above your ankle. Early in the course of a blood clot, there may be no or few symptoms, such as leg pain or leg swelling. When a blood clot gets extensive and affects the major deep veins, you will feel acute pain and acute swelling. Even some extensive blood clots may present without signs and symptoms. Since the deep veins cannot be directly assessed clinically, a blood clot can only be inferred indirectly by what we see on your physical exam, making a history and physical examination unreliable in the diagnosis of blood clots. Therefore, we need objective studies to be able to confirm or exclude a blood clot in your veins, which leads us to the studies that help us diagnose the vein problems. Duplex ultrasound has become the standard of detection blood clots and the preferred method for evaluation of the leaky valves, which when we do them, we can see if there's an actual blood clot in your vessels. And also for the leaky valves, it can tell us if the valves are not closing right and allowing blood to reflux back down to your legs. A duplex study is a non-invasive test that we are able to do here in our vascular lab. And it usually takes from 30 minutes when we're trying to look for blood clots, or it can take up to an hour when we're trying to assess for venous insufficiency or take a look at those leaky valves, because we have to look at the superficial veins like the greater saphenous vein and lesser saphenous vein, but we also need to look at all your deep veins of your leg. So let's jump into treatment. Treatment for chronic venous insufficiency or the leaky valves is done by compression therapy. It's the mainstay for when you have leaky valves. Compression can be achieved using a variety of techniques, but most commonly here in clinic, I usually prescribe a compression sock. If complications from the leaky valves get worse and you develop necrosis of the skin with leg ulcer formation, we will commonly use a Unaboot, which is a multi-layer compression dressing. It involves a zinc oxide wrap followed by a Curlix wrap to help the following layer, which is a ACE bandage, from not getting down. Patient compliance with compression therapy is crucial in treating chronic venous insufficiency, and especially when you have a venous stasis ulcer. When compression therapy takes longer than usual and we don't see the venous stasis ulcer progress, we usually use a skin substitute to place over the wound and to help the wound healing. Additional procedures like superficial vein surgery is currently accepted in combination with compression therapy. Although superficial venous surgery had no additive effect to compression therapy alone in the healing of venous ulcer, it did show to reduce venous ulcer recurrence. Okay, so there have been some studies where patients who had superficial vein surgery and in addition to compression therapy, they showed that recurrence of a ulcer was less likely. So it is reasonable for us to offer ablation or removal of superficial veins in addition to compression therapy in patients with abnormal superficial veins. So we have to have evidence that the greater saphenous vein or the lesser saphenous vein have insufficiency in order to justify to do this, in addition to compression therapy on patients who have severe chronic venous insufficiency like skin necrosis and leg ulcers. If you develop a blood clot, the treatment is medications to help dissolve this blood clot and prevent complications like pulmonary embolisms, which has a higher mortality than the blood clot itself. But if you're going to be exposed to a condition like surgery, hospitalization, that will increase the chances of you developing a blood clot, most of the time we take measures to prevent you from developing the blood clot. Like after your surgery, we highly recommend as soon as you can to get up and walk. That's why we do it, to help you prevent blood clot formation and be able to take away the risk that those blood clots have on you. If, for example, you can't get up as quickly as we would like you to, for given the nature of the surgery, we might, and he or she, your doctor in the hospital, might prescribe a medicine like heparin to help you from not developing those blood clots. Thank you. That concludes our video. If you have questions about specific topics that you would like for us to make a video on, please leave it in the comment section below. Please like and subscribe so you can get notifications when our next video goes live. Thank you, and until next time.